Now, 2020 was the year of the COVID-19 pandemic, and to this day, the number of fatalities has risen to above 2.81 million globally. But COVID-19 wasn't the leading cause of death last year. It came third after heart disease and cancer in the United States. And according to the US Centers for Disease Control and Prevention, heart disease took over 690,000 lives last year. Patients with cardiac conditions have been all the more vulnerable to COVID-19, and there have also been concerns that contracting the respiratory disease leads to long-term cardiovascular complications, even for those with no history of heart issues. We address these concerns today. We connect with Dr. Garry Jennings, Chief Medical Advisor at Heart Foundation of Australia and board member of the Cardiac Society of Australia and New Zealand. Very warm welcome to you, Dr. Jennings. How are you this morning?
I'm fine, thank you, Seong.
Well, thank you for being here. And as we heard last year, there were quite a number of reports of increased deaths from cardiac arrest in the wake of the COVID-19 pandemic, especially in New York City, where there was a nearly 400% increase in home deaths in late March and April last year. This actually coincided with a drop of around 50% in the number of people seeking emergency treatment for heart attacks. Why do you think this has been happening, and has this been an ongoing phenomenon in other places around the world?
Well, it's certainly a big feature of the early phases of the pandemic, and it was seen, as you said, in New York City, where some of the figures have been questioned more recently, as you probably know, but it was also reported from Italy and Spain. Essentially, people were no doubt hesitant to go near health services where they knew people had COVID. They're worried about catching COVID themselves. The health services themselves were having to adjust to the new situation and were triaging patients differently. And all in all, this added up to more people suffering from heart disease and dying in the community. Some of those people would have been unrecognised COVID, but there's no doubt that some of the more common causes of death, particularly heart disease, was happening much more often out in the general community.
And we're seeing how hospitals and medical workers, they're being overwhelmed by COVID patients. How has the pandemic really affected doctors and their capacity to respond to people suffering cardiac arrest, and also those with pre-existing conditions waiting for heart transplants, to be, for instance?
Well, firstly, it was extraordinary in the early phases how the community globally galvanised, and we were having daily chats with people all around the world as they talked about their experiences, ideas they had about dealing with the situation, hacks, if you like, ways of doing normal things in abnormal situations. But generally, the need for protective equipment, the fact that a lot of elective activity got stopped, the fact that people were uncertain about whether something like a heart transplant could be done in this context. And of course, if we're talking specifically about that, people were in lockdown, they weren't driving around, there weren't so many donor hearts available either. So that, along with a whole lot of other high-end procedures, slowed down or stopped considerably, while doctors found and clinicians and health policymakers found new ways of doing things. The other thing that happened out in the community was that certainly here we had a switch towards telemedicine. That is, instead of people going to primary care, they were doing it by on their smartphones or by other mechanisms, and still getting their prescriptions, but they weren't getting their normal tests as much. So the chronic management of disease also probably halted a little bit too.
Well, the thing is, the four common cold human coronaviruses, they've not been associated with heart abnormalities, but is COVID-19 any different? And how does it affect people who have pre-existing cardiovascular diseases?
Well, COVID-19 probably is different, and as you know, we're seeing thrombosis, that is blood clotting, as one of the things that are associated with very severe COVID, and that can affect the heart or the brain, from causing stroke and other things. But also there's been nothing studied as closely as COVID has in the last year or so. And it's quite likely, I think, that if we were to put some other respiratory conditions under the microscope, we know that some of them will cause inflammatory heart problems, and I suspect it's much more common than has previously been recognised.
Well,
the question is whether it happens in the long term.
Well, there has been concern that the coronavirus could trigger severe cardiac inflammation. And according to some reports, as many as 7% of deaths from COVID-19 might be due to myocarditis. And now millions are contracting the coronavirus. Is there a danger that there'll be an increase of patients with heart failure?
Yes, there certainly is. I think coronavirus, or SARS, COVID-19 is one virus, but it's really a number of several conditions. There's the sniffles and the cold that a lot of people get, or no symptoms at all. There's people that for some reason get a pneumonia, a pneumonitis as a consequence. And then there's the people that get widespread damage to the rest of the body, including the heart, the kidneys, the brain, the blood vessels. And that's a small proportion, very small proportion of people that have COVID, but an important one, because as you say, it may well be one of the things that's leaving people with long-term complications.
Well, now there's a lot of questions about vaccines. Are they safe? And of course, this is also a huge concern when it comes to people with pre-existing heart conditions. So at this point, would medical professionals say that the COVID-19 vaccines are safe to take for people with underlying heart conditions?
Well, you're right. There are plenty of questions about the vaccines, but the one thing that I think every health professional will say is that they're much safer than getting COVID and risking the more severe complications, and that applies in particular to people with underlying cardiovascular disease, because we know they're at much more risk than the rest of the population of getting the severe complications if they get COVID. So we would suggest that whatever your doubts about this vaccine or that, it's much better to have whatever you're offered and have it as quickly as you can find it available.
And as you pointed out earlier, a lot of people have been worrying about actually going to hospitals when there are many, many COVID patients there. What happens, though, if they don't get treated right away and they're actually experiencing cardiac arrest or some kind of severe condition?
Well, our recommendations are exactly the same as normal. If you get chest pain or signs of a stroke, the various signs of a stroke or something acute, every minute counts, because the quicker you can get to an acute facility, the more likely you are to get the acute treatment that will reverse the situation. And that is much better than waking around worrying about whether you should or should not. We would rather see people who turn up worried about a heart attack and in fact are shown not to have one, than to miss somebody who might die in the community. Get to hospital, ring your emergency number, get by ambulance if you can, and the hospitals will be ready for you, and they know how to manage it, and they know how to protect you from getting COVID.
And new research has found that heart attacks are more likely to be fatal among people with no risk factors. Are there any clues as to why this is the case? And what does this really mean for medical healthcare workers and also patients themselves being able to anticipate the risk of heart failure?
Yes, this is a very important new finding from my colleague Gemma Figtree using Swedish data published in The Lancet in the last week or two. Not everybody that presents to hospital with a heart attack has the standard risk factors like blood pressure, high cholesterol, diabetes, smoking, etc. There are a number that turn up without any obvious risk factors, and we've been a bit suspicious that number might be even increasing, but it's certainly somewhere in the 15 to 20%. And those people certainly are at higher risk of the most severe complications of heart attack, like sudden cardiac death. It seems to be more common in women. I don't think we really understand the mechanisms behind it. I think the major need is for more research in the area, but certainly nobody's immune from heart disease, I think, is the message there. And if you think you've got symptoms, then get it checked out, no matter how healthy you might be, as far as your lifestyle and other risk factors are concerned.
And it's quite surprising that a number of young people have been suffering from more cardiac arrest as well. So this really means that, well, nobody is safe and there's no way to really anticipate it.
Yes, certainly, this is a condition or a set of diseases that are much more likely as people are older, but there's no question that it can occur at any age, and it can occur in women as well as in men. Nobody can be considered a stereotype for heart disease. Everybody needs to have some sort of heart health check, particularly as the years advance.
Well, most of us believe that exercising regularly and going outside, going for a jog, those things really benefit heart health. But COVID-19 has meant that we have to stay indoors and we're living in a very restricted sort of space. Does this worry you at all?
Yes, it does, although our evidence has suggested that, particularly during periods of lockdown, quite a lot of people have taken up more healthy lifestyles. They've started cooking at home where they might have eaten fast foods more often in the past. They've taken up physical activity. A lot of the response to some of the mental health issues that we've seen that are more common has been not so much to go and seek medical advice, but to adopt new hobbies, which might involve physical activity, take up knitting, do more cooking, all sorts of other things that people are doing post-COVID that perhaps they weren't. And many of those are probably contributing to their heart health as well as their mental health.
Well, what are ways that we can really help prevent heart failure, and what should people do when they are experiencing symptoms?
Well, I don't think there's anything, any rocket science in this. I think it's a matter of making sure that if you've got you're under treatment for heart disease or for risk factors like high blood pressure or diabetes or cholesterol, make sure that you look after your heart health as well as all the things we're doing, social distancing, wearing masks, etc., to prevent us getting COVID. So keep your treatment up, and of course the things you've just mentioned are so important: remaining physically active, eating healthily, and looking after your mental health.
And well, we are expecting medicine to become more personalised, predictive, and even preventive. Are there any medical technologies that you're particularly excited to see develop in terms of really being able to stop heart disease from progressing?
Well, our experience this year has been extraordinary in terms of the rate at which technology has advanced. If you think of some of the vaccines, they've been created using mRNA in ways that we've never been able to do before. There's been big advances in telemedicine, our ability to care for people out of hospital and to do things in other ways. The genomic revolution has really kicked in here and helped us in screening, in finding where particular cases come from, in contact tracing. Our public health technologies have improved, and all of these could be applied to the management of everyday conditions like heart disease in future. And one of the key things we have to do from this experience, apart from getting through and making sure people are safe, is to learn from it and to apply those learnings to the more broad conditions of health. I think the other thing we've learned is that dealing with this as a health problem with economic and political consequences is more important than using one or two of the others as the primary driver of policy.
Well, that's all we have time for today, but that was Professor Garry Jennings, Chief Medical Advisor at Heart Foundation of Australia and board member of Cardiac Society of Australia and New Zealand. Again, so thank you so much for your time.
Thank you.
And to our viewers around the world, thank you very much for watching and have a wonderful weekend wherever you are. Goodbye.